COPD and emphysema. What you need to know before shortness of breath gets worse. Introduction. You know that feeling like the air just isn't coming in? That even sitting still, breathing feels like a struggle? It may sound exaggerated to some, but for people living with COPD or chronic obstructive pulmonary disease, this is daily life. What's even more alarming is that many people don't even realize they have it. They blame age, being out of shape, or stress. Until one day, just climbing a flight of stairs feels impossible. And when the diagnosis finally arrives, it often comes with a heavy label: emphysema. But here's the truth no one talks about enough. COPD can be managed. And the earlier you understand what's going on, the more control you have over your breathing and your quality of life. In this video, you'll learn what COPD really is, how it differs from emphysema, the warning signs, and most importantly, what you can do to prevent the condition from progressing. If you or someone in your family has a chronic cough, shortness of breath, or a long history of smoking, this video could change everything. COPD is a chronic and progressive respiratory condition, and it's seriously underestimated. It mainly includes two diseases: chronic bronchitis and emphysema. Both limit airflow in the lungs, but through different mechanisms. Chronic bronchitis causes ongoing inflammation in the bronchial tubes, the airways that bring air to your lungs. Emphysema damages the alveoli, the tiny air sacs where oxygen exchange happens. These sacs break down and lose elasticity, trapping old air and making it hard to bring in fresh air. The result? The lungs act like a deflated balloon, stuck, restricted, and unable to release used air. This causes shortness of breath, even during light activity like walking, talking, or getting dressed. The main cause? Smoking. But it can also develop from exposure to pollution, chemical dust, wood smoke, or even genetics. What makes COPD so sneaky is how slowly it progresses. It starts as a smoker's cough. Then comes the morning phlegm, until one day, breathing becomes a daily challenge. Symptoms include progressive shortness of breath, chronic cough with mucus, chest tightness, wheezing, frequent lung infections, and in later stages, weight loss and depression. And yes, the emotional toll is real. Living without air can feel like a silent prison. But here's the good news: COPD is treatable. While there's no cure, you can slow the progression, control symptoms, and improve your life. The first step? Getting diagnosed through a spirometry test, chest x-rays, and a full medical assessment. And quitting smoking? It's the most powerful move anyone with COPD can make. It's like taking your foot off the gas pedal just before the cliff. It won't fix everything, but it changes the trajectory. Treatment usually includes bronchodilators to open the airways, inhaled corticosteroids, pulmonary rehab, oxygen therapy in more severe cases, and lifestyle changes like healthy eating, light exercise, emotional support, and regular follow-up. Education is also key. Knowing when to seek help, preventing infections, staying up to date with vaccinations, and making smart choices day to day can completely reshape the journey. Want a real-life example? Picture a 67-year-old ex-smoker. He's been feeling tired but thought it was just age. One day, a severe shortness of breath lands him in the ER. The diagnosis? Moderate COPD. With the right treatment, pulmonary rehab, and 0 cigarettes since, he's walking again, socializing, and enjoying life outdoors. What changed? He took control of his lungs before they took control of him. COPD and emphysema don't have to define your life. With the right care, early diagnosis, and lifestyle changes, you can live freely, breathe better, and regain your independence. This video is for informational purposes only and does not replace medical advice. If you relate to any symptoms, see a pulmonologist and get the tests done. Now tell me, had you heard about COPD before? Do you know someone living with it? Drop your story in the comments. It might help someone else seek help in time. And if this content brought you clarity or hope, give it a like, subscribe to the channel, and turn on notifications. Because breathing is life, and so is information.